Now, the National Education, Health and Allied Workers Union, NEHAWU, has called for a mass protest on the 21st of August against poor working conditions. Briefing the media a short while ago, NEHAWU has accused government of not ensuring adequate personal protective equipment supplies are delivered to healthcare facilities nationwide amid the coronavirus pandemic.
Call on government to abandon the current decentralized and fragmented approach in the procurement of PPEs as determined by guidelines on the management of the coronavirus in the public service issued by the Department of Public Service and Administration. Demand number 6, that the National Department of Health must review the process of reporting on COVID-19 fatalities in all institutions to ensure adherence with the uniform standards as recommended by the World Health Organization. In this regard, we also called on the Department of Health to compel all institutional managers to regularly update NEHAWU and other trade unions on all coronavirus and COVID-19 data, especially pertaining to the health care workers in the institutions. Government must fill all vacant posts in the public health sector and ensure that we start to building blocks for the implementation of the National Health Insurance. Demand number 8. We call on government to implement a risk allowance for the frontline workers for the hard work and the sacrifice of their lives and families during this fight against this invisible enemy. This includes honoring the salary adjustment for public servants by implementing the last leg of Resolution 1 of 2018 as is.
My colleague then, Mbongeni Muthwa, did attend that briefing as well, and he's covering this story for us. Mbongeni, I'm not sure, of course, on how much will ever be enough when it comes to the protective personal equipment, but you've also got a shortage of staff in some hospitals as well, and these frontline workers are going to need help, so they're saying they want more.
Yes, absolutely, Arabile. NEHAWU continues to complain about the issue of the inadequacy of personal protective equipment in hospitals around the country. This is not a new gripe from them or concern. It goes back to the early beginnings of the national lockdown after the end of March. In early April, they even went to the Labour Court asking the court to force the minister or to instruct the Minister of Health, Dr. Zweli Mkhize, to meet with them because they were complaining that there was not enough PPEs in hospitals, and that was endangering the lives of their members who are frontline workers. Well, the picture that they paint now is 4 months on. As far as they are concerned, not much has changed. They are saying their members are exposed to danger. They are saying, in fact, many of them are dying around the country. If they complain to hospital management, in many cases they get dismissed and so on. So it's quite a lot of complaints, and now they are saying they're going to be embarking, as you've mentioned, on a program of action, lunch hour pickets, marches to various government offices, even the President's office, to demand better provision of PPEs, culminating in a full-blown strike, they say, a work stoppage on the 10th of September. It's unimaginable that you could have a full-blown strike in the middle of the current public health crisis in the country, but that's what they are threatening to have their demands met in this regard, Arabile.
Yeah, Mbongeni, have you gotten any word with regards to government playing their part perhaps in this and trying to alleviate some of the strain? Has government responded in any particular way when it comes to how much personal protective equipment and the like, as well as more healthcare workers and the like as well, being offered to hospitals and healthcare workers across the country?
Well, we have been getting, of course, as everyone is aware, we have been getting regular updates in terms of government efforts to fight COVID from the Minister of Health, Dr. Zweli Mkhize. He's been going around the country checking the situation in various hospitals. Not much has been said around issues of PPEs from official government statements. In terms of the specific allegations that NEHAWU has made just now, I mean, the press briefing has just finished, so at this point there is no official government response as such. But of course, government is going to have to come out and address this. All we know is that even earlier on during the outbreak of COVID, they did acknowledge that there was a shortage of PPEs globally, because there have been such a high demand globally for PPEs, and but they say the government has always maintained that no health worker or frontline worker has been forced to work without the necessary protection of PPEs, and up to now, that remains the official government position. So the government is most likely going to deny that health workers have actually been put in danger. Even some have died, because that's what NEHAWU is alleging, that they are burying their members in different parts of the country who have succumbed to COVID-19, and they are blaming the employer, which is the government, for that, which is quite a serious allegation indeed, Arabile.
Yeah, so much so, really. I think the wait continues here, Mbongeni, to really find some way to kind of help as much as possible. Then, of course, those frontline workers will need every ounce of help they certainly can get. Thank you so much for that. My colleague, Mbongeni Muthwa, following that story for us then, as NEHAWU does announce that mass strike then on August the 21st for healthcare workers, seeking a little bit more when it comes to PPE deployment as well to a whole lot of healthcare facilities.